The AV delay is this figure here, and at high rates of pacing this is invariably set to 150 milliseconds. This is the time it takes between an atrial event and a ventricular event, and you can see from the lights that are flashing here the time between there is a time delay between the atrium and the ventricular lights flashing. That time is 150 milliseconds. In this device, the AV delay is tagged to the pacing rate, and as I reduce the pacing rate from 92, you'll see that the AV delay, which is here, starts to increase. So once I'm down at 60 beats a minute, you can see my AV delay is now at 200. If I drop further to 50 beats a minute, my AV delay has stretched to 220. This is very physiological, and it helps with allowing enough time for the ventricle to fill with blood before you pace. If you had left the AV delay at 150 milliseconds, then the ventricular pace will come too early before the ventricle is completely filled, and that would reduce the cardiac output in the patient. Now, no sooner have you learned that the two are tagged together, then you will ask, how can I separate the two? Because there are times when you need a very long AV delay, and the quick way of doing it is just to give the AV delay control a twist to one side, and then you can now independently program the AV delay.